So more than half of the women in a nursing home have accidental bowel leakage or fecal incontinence. It's a huge problem. And when you get fecal incontinence, she's just sitting there in stools. Stools will go in the front, contaminate the urethra. Now she gets bladder infections. And then from there, she could get kidney infections and become septic. From a condition that can be so straightforwardly, easily controlled in a doctor's office. Once we do the examination, then we do proper testing. And there's some key tests that are required. One is the stool diary to see the consistency of the stools, then to see what is anorectal manometry, which is the pressure study of the rectal sphincter and how much can the patient hold. And the third important is whether she can expel the balloon out. That's also important to see. As she's sitting on the toilet seat, we have her push out a balloon filled with water. And then we do an ultrasound to see the integrity of the rectal sphincter. Is it completely intact or is it broken up? So as you can see in this particular slide, it's completely intact. You can see that white structure going all the way around. That is the external anal sphincter. And you can see here that it is disrupted. In the front, it's black. That means it's sonolucent. There is no sphincter present and that's disrupted. So it's not a complete cylindrical sphincter around the rectum. So we look at those factors and then we decide based upon her history, my examination, and these testings as to what is the best course of action for the patient. And this is a combination of treatment options. It's not just one thing that is going to take care of it. A lot of things that have to be done to help with the bowel leakage. But that said, so much can be done right here at our office. And this is what we specialize in bowel leakage. We see a lot of patients with not just vaginal prolapse or urine leakage, but also with bowel leakage. And it is a big problem. Granted, it happens more in the elderly, but it could happen to a 30-year-old who just had her second child and she has bowel leakage now.